Well, thank you for everyone who joined today. We have some lovely panelists that are here to give us lots of information about contract negotiations and what steps to take from here. Our first panelist is Dr. Romero. He works at Meridian Psychiatric Partners. He's a board certified general adult psychiatrist. He got his medical degree from LSU, School of Medicine in New Orleans, and then did general psych residency at Eastern Virginia Medical School. Some clinical interests are psychopharm, psychotherapy for anxiety disorders, depression, bipolar, and substance use disorders. And he, according to the website, sees patients at the downtown location. And right afterwards, we'll be hearing from Mr. Willuweit, who is with Monahan Law Group, and his practice is in mental health law, confidentiality, risk management, healthcare law, professional licensure, elder law, guardianship, and probate matters. And he did his law school training at Loyola University, Chicago, where he also served as senior editor for Annals of Health Law. And he was also involved with the Beasley Institute for Health Law and Policy and some of their planning that they did. So I welcome both of our speakers. Dr. Romero, feel free to take it away.
Yeah, absolutely. Thank you for the introduction there. So yeah, Jasleen asked me to be on this panel to basically kind of share my experience and things I wish I had known as I was kind of leaving residency and entering the first phase of my career. So basically, I'll kind of tell my story here. I was finishing up my residency in Virginia. And the last year of my residency, I started moonlighting at a private practice in the area. I was kind of referred to that practice by the program director at the program there. The owner of the practice was a former chief resident in the residency. So, I felt good about that. I felt, the practice had been around for about 20 years. So it was well established in the community. I felt pretty comfortable with the reputation of the practice. I had good experiences moonlighting at the practice and kind of made a lot of assumptions based on that information. There was an associate professor at my residency who was also kind of working a day or two a week at this particular practice. And so I kind of asked them what their opinion was. They didn't have anything negative to say. I asked a couple of the drug reps in the area kind of about the practice, and everything was super positive. So I felt good about, my experiences with this particular practice. Kind of the first thing, so when I signed on to this particular practice, I signed on as a W-2 employee, but a lot of private practices do what's called a split, where based on the amount of your billing, you're bringing in a certain gross amount of revenue from either, whatever the revenue source is, if it's Medicare, Medicaid, private insurance, self-pay, whatever. And most practices in that model do some kind of split where it's like, okay, you keep 70% of that gross revenue and 30% of that gross revenue goes to, paying the overhead of the business. So that was the model that this practice had. That's what I agreed to. But as I was kind of looking at our initial contract, I was aware that it was going to take me at least a year to build up a full client load to where I would be making, what my ultimate salary would be. And so I asked the owner of the practice if they would be willing to, guarantee me a minimum salary for those first couple of months as I was starting out to just kind of, float me until I kind of developed a full client load. And this was the first red flag, because they were like, well, we're not willing to do that, but we would be willing to give you a loan that would need to be paid back. And that struck me as a little bit odd, but I kind of, made an assumption that, okay, maybe this is just kind of the way things go. And I didn't want to, upset anybody by being too forceful. So I just kind of, accepted that, and accepted that I was going to have to live pretty frugally for those first couple of months until I developed a client base.
Yeah.
So I started working full time, and about a week into my tenure there, one of the therapists comes into my office and is like, "Hey, Dr. Romero, I was wondering, are you looking for other places to work, or are you looking for another job?" And I'm just like, what are you talking about? I just started here a week ago. And this therapist was like, well, yeah, over this last month, a lot of people have left this practice because people aren't being paid what they're owed. Like we're seeing patients, certain number of hours in a week, and our pay, it does not correspond to the amount that we're working. And that, that shocked me, but I was, pretty confused by that, but I had committed to this practice, and I was a weekend, and so I just kind of wanted to see how things would go. And I really didn't have any other options at that point. I hadn't really looked at other practices in the area like I should have. So that was strike number two in my mind. It just rubbed me the wrong way. So I kind of kept that in my back pocket. And then ultimately, a couple of months down the line, so we would, we were on a 2-week pay schedule. So every 2 weeks, is when we would be issued our paycheck. And in every 2 weeks, we would get a breakdown of 4 different columns. The first column was the number of patients we had seen, or the number of hours that we had billed for. The second column was, the amount that we had billed to insurance, or the amount that we were trying to get paid from insurance. The third column was the amount that insurance had actually paid us, or actually reimbursed us. And then the fourth column was the amount that we expected to be written off, or the amount that we expected not to get returned from the insurance company. And I kept looking at, these different columns, and they weren't really adding up or making a whole lot of sense to me. So I ended up bringing a couple of these paychecks and pages with these various columns to the owner of the practice. I was like, look, I'm curious about these columns. Can you kind of explain them to me in a way that makes sense, or let me know what to expect going forward. And the owner of the practice, I'll never forget this. He had this was probably in 2017 or so. He had owned the practice for about 10 years at that point. And he looked at me with kind of this befuddled look. And it's like, Jordan, I'm not really sure, but I can let you know, I can let you talk to our business manager, and maybe they can explain it to us. And that was strike 3 for me. I mean, I realized that, okay, this guy has owned this practice for 10 years and doesn't have a working knowledge of how his practice runs, of how he's being paid, of how he's being reimbursed. I mean, I could go on about the horror stories about this practice, but basically, there are a lot of reasons that insurance companies will not pay you. If you've written down a patient's name wrong, if you have their birth date wrong, if you've written down their their insurance ID wrong. Basically, if you have front desk staff that aren't competent, aren't able to take down accurate information, you will not be paid. And if the person submitting your bills to the insurance company isn't filling them out right, they get rejected, they get sent back to your practice. And our practice didn't have a system of rectifying those bills or correcting them and resubmitting them to insurance companies. Basically, somebody was getting these returned bills in the back office and just putting them in a pile, and that was it. Like there was no system. And so from that point, this was probably 2017, 2018. I was looking for other places to work. I was aware that things weren't going to improve at that particular practice, and I needed to find a different location. But I became aware that I needed to know, going into interviews with a practice, I needed to know what questions that I should ask to be able to gauge the financial health of a practice. And so that's kind of what I'm trying to give you here at this panel. So, just, things to think about going into an interview, and I'm happy to email this list to Jasleen if you'd like it. Feel free to take notes, but first, the first question to ask is where does your practice receive referrals from? Like, where are your patients coming from? Are you relying? Is this practice relying solely on search engine optimization on Google, or do you have actual relationships with primary care practices in your area, with neurologists in your area? Does your practice have a relationship with the local hospitals, the local universities? Those are important things to know. And if the prospective practice that you're interviewing with doesn't have a good answer to that, or is kind of cagey on some of these questions, you may want to dig deeper a little bit. Second question to ask: what is the payment source for your patient base? Are you taking only self-pay patients? Are you taking Medicare, Medicaid patients? Do you see patients that have private insurance? Is there some kind of mix of different pay bases? And based on that mix, that's going to determine what your reimbursement is. Even in the world of private insurance, different insurance companies reimburse at different rates. So it wouldn't be it would probably be a good idea to ask a prospective practice, like, can I see an example of one of your providers billing summary, and can I see how much they billed to different insurance companies and what the reimbursements were? I mean, you can get them to kind of anonymize that, so you're not seeing a specific provider, but if you're worried about kind of what your reimbursement is going to be, it'd be a good idea to have some kind of information on basically where your reimbursements are coming from. Things to think about in your employment. Will you be a salaried employee, or will you receive a split of the gross revenue? If you're a salaried employee, I guess the downside to that is that that there's a cap on your income for that year. Like, okay, I am receiving this amount of income for this year. The plus side of that is that you don't have to worry about no-shows. you know. So if you have 5 patients scheduled in a day and 3 of them don't show, that's not your problem as an employee. You know, that's your employer's problem, and you're kind of guaranteed a certain rate of pay. Now, if you're you're on some kind of a split, a 70-30 split, and you have 50% of your patients don't show in a given day, that's you're not being paid for 50% of that day. They call it kind of the eat what you kill model. So also something to think about. I mentioned asking for an example of another psychiatrist pay breakdown. But yeah, I would be clear on, okay, how much is one of your providers billing to insurance? How much is actually being reimbursed from the insurance, and what amount of the billing that you're doing are you expecting to be written off, or are you expecting not to get back from the insurance company? Will you be a W-2 employee or a 1099 employee? So W-2 means you're kind of employed by the practice. You are given benefits by the practice, usually some amount of insurance, like a 401k plan, that kind of thing. As a 1099 employee, I think somebody has their microphone on. I give it all to him. Are you going to be serenaded by one of your patients on a given day? These are important questions to ask. Yeah, are you going to be a W-2 employee or a 1099 employee? 1099 means basically you're a contracted employee and you're responsible for securing your own insurance, your own liability, your own retirement plan, and that kind of thing. A lot of times the 1099 model, it's a way for practices to kind of get around paying employment tax. So just something to be aware of. But if you're someone who likes to research and likes to figure out, like, okay, well, I can get a cheaper health insurance plan or cheaper liability plan, that can be a way to kind of maximize your income if you're someone who likes to research that kind of thing. What benefits does the practice offer? Are you going to be given the option for health insurance, dental insurance, vision, short-term disability, life insurance? Is there a 401k plan? Are they willing to match a contribution to your 401k plan? That's a pretty good indication of financial health of a practice. Are you going to get paid time off? Are they going to give you continuing medical education days and reimbursement for CME? All important to know off the top. If they do provide liability insurance, what kind of liability insurance is it? Is it a claims made versus occurrence liability insurance? Occurrence liability insurance just has to be in effect at the time the occurrence happened, at the time the patient interaction happened, or at the time you prescribed a certain medication. Claims made liability insurance has to be in effect at the time the claim is made. So that's important to know, because claims made in liability insurance, basically once you leave that practice, it would behoove you to purchase what's called a tail liability insurance, which covers you for any kind of malpractice suit for however many years after you leave that practice. The benefit of occurrence-based liability insurance is that you don't have to purchase a tail for your liability insurance. I would be clear if there's any kind of non-compete clause or restrictive covenant in your employment contract, usually for a number of years after termination of the agreement and within a certain mile radius. actually, that's kind of how I ended up at Meridian Psychiatric Partners. I originally interviewed with another practice in Chicago. And it was like, I was going to be moving to Chicago, and this particular practice wanted me to sign a contract that was like, it was a non-compete for 2 years with an 8-mile radius around their practice. I was like, look, I hope this is the last job I ever have. I hope I love it at this particular practice. But if things go south for whatever reason, and I have an 8-mile radius around Chicago that I can't work in, like, I'm not going to be able to make a living. And this particular practice owner told me, well, that's pretty standard for this area. If you don't like it, you can investigate other practices or whatever. And I took their advice, and ended up with a practice that I felt more comfortable kind of negotiating with. I felt more comfortable negotiating or talking about these points in our employment contract. But just something to be clear on up front. And then if you do sign an employment contract with a non-compete, I would make it a point, if you're looking to sign with a private practice, I would make it a point to have some kind of line in there like, okay, well, what if I agree not to work at another private practice in the area that would be competing for patients with your practice? Could I work at like a nonprofit community mental health center, an inpatient unit of a nonprofit hospital, an IOP for a nonprofit or a governmental agency? So at least you would have some kind of way to make an income in that area if you needed to go like a full year or two without competing with that particular practice. So that's kind of my spiel. I will say, after having kind of a nightmare scenario at my initial practice, I've been very happy at Meridian Psychiatric Partners. We just kind of the interaction initially with the practice owner, Dr. Flavio Arana, just went really well. He was very willing to kind of hear my concerns and negotiate different points in our contract. We have locations all over the city: Chicago, Evanston, Lake Forest, Oak Brook Terrace, Oak Park. We have about 60 clinicians now, kind of an even split between psychiatrists and therapists. And we're always looking to hire good people. So, if you're someone who's interested in a private practice model that's run well and well respected in the community, feel free to email me after this. It's jromero@meridianproviders.com, and I'd be happy to answer any questions that you may have. With that, Jasleen, thank you for the time, and I'll yield the floor here.
Thank you so much. I feel like I learned so much just from those like 20 minutes. And now we kind of switch gears. Mr. Willuweit's going to look at it from the legal perspective. So I'm excited to hear that part. Take it away.
Thank you. So I have less of a compelling story than Dr. Romero as an introduction, but I think there's a lot of lessons and a lot of hard-won lessons that he talked about. At the risk of sounding, like if your only tool is a hammer, every problem looks like a nail. Probably pretty rich coming from an attorney, but legal review, I think is one thing. Participated in a similar panel a couple years back, and I think, again, maybe coming out of residency, or you're maybe switching your employment, and it's maybe not a great time to be hiring a lawyer, or hard to find a lawyer, or what have you. But legal review, just from a competent attorney, employment attorney, someone familiar with healthcare law, I do think that an ounce of prevention is worth a pound of cure, and just identifying the specific legal provisions, it is something that, I know that employers do think a lot about, and employees should treat it as equally, to know the law and the specific provisions in the contract. So just legal review as a blanket, kind of piece of advice, I think is a smart thing to do. Knowing who you're contracting and getting into business with. I mean, I think that's a big takeaway from Dr. Romero's, and, it's like, oh, the legal perspective, but that's so important, because it is a negotiation at the end of the day. And, it's going to have a big effect on your day to day. So, to know who you're contracting, get familiar with the culture, the billing practices, if working with therapists, this may not be specifically in an employment contract, but certainly will be in the interview process, or, these initial discussions about, am I supervising, personnel? Like, some people may just, have a more direct service delivery as their scope of, in their role in the organization, especially when they're newer. But how does this work? Am I going to be supervising? What is my interaction going to be with, maybe the owners or partners, if it's a larger practice, or, ancillary personnel therapists are going to be there. So knowing those sorts of details on the front end. Independent contractor and 1099 versus an employee, that's definitely a big thing that I'd just like to emphasize again. You can have a document that says, physician employment agreement, or just employment agreement, or physician services agreement, or professional services agreement. And if you're not really, attuned to and understanding the difference that, oh, this is a 1099 agreement versus a W-2 employee agreement, that's really going to change, how you're looking at things. Compensation, $300,000, as a W-2 salary versus $300,000, as an independent contractor. That's really going to be a big difference in the, your take home at the end of the day. So knowing that kind of thing. And misclassification as well of independent contractors versus employees. That's a big issue for employers. And some of what I'm saying, I think, is not going to be, the really technical, pieces of, this contract provision. That's what lawyers, get paid to do. That's what we look at day to day. That's not what, a lot of prospective, clinicians are going to be looking at. But, a lot of these things do raise red flags, and so, is this employer, it goes back to the fit, the culture, the relationships, is this employer trying to, put in a non-compete in a major, metropolitan area that's 8 miles? That's a huge swath of, if you're based in downtown Chicago, so is that reasonable? And that's part of this, from my perspective, is this reasonable? Are the contract provisions reasonable? Is the negotiation that you have, is the overall presentation of what this role is going to be, is it reasonable? And one of those things is, the term and the termination. So it's really easy to get into a contract. You sign your name, everything looks good. But the termination, is really the separation. I really loved when Dr. Romero was saying, "This is where I want to be." Hopefully this is my last job, and that's a fantastic way to go about it. If it's not, that's really when you find yourself involved with lawyers on the back end, which is where you don't want to be involved with lawyers. Better on the front end. So what constitutes for cause? Generally speaking, employment, especially in the state of Illinois, but generally around the country, at will. At will is a predominant model of employment. So you can hire, fire, for any reason or no reason. For physicians, you may have a term of years. You may be at will, or you may have a term of years, which would be 2, 3, 4, whatever it might be. That has benefits. I see that more rarely these days. I think generally, folks are at will. And so if you do, there will be for a cause. And so there can be very specific, very, sort of into the nitty gritty of what does termination for cause mean? What does termination by the employee mean? A termination by the employer not for cause, because all of those different scenarios can trigger different provisions in the contract. So, penalties, pretty common. If you say as the employee, you do decide that things aren't working out, or you want to leave this position, can you do that? Can you do that in a certain time frame? And are there penalties associated with that? So together with restrictive covenants, which is the non-compete, the non-solicitation, there are specific rules around those in Illinois. One of the just bright line rules is, generally speaking, 2 years. So a restrictive covenant is, generally speaking, not enforceable unless you're in a position for at least 2 years. Because one of the basics of contract law is consideration, mutual promises. Each side has to get the benefit of the bargain. That's kind of how the law is shaped around contracts. And so if an employee is going to have a restrictive covenant, a non-compete or non-solicitation, non-compete being a time and distance restriction, like Dr. Romero was saying, 8 miles in 2 years, that's a non-compete. A non-solicitation is you can't take patients, or you can't take clients with you if you leave, or you can't take other employees with you when you leave. Those kinds of things, again, generally speaking, 2 years, of continued employment. So employers, who from their perspective are putting a lot of, time, energy, money into onboarding new clinicians, they're going to say, what can we put in this contract to make it difficult to leave in the first 2 years? Not every employer is going to have that, kind of perspective, but some do. And so maybe during the first 2 years, the termination provisions in the contract are going to be more onerous. Maybe it's a payback of a signing bonus, or it's going to be, some other kind of penalty. And so the legality of that really is going to depend on the circumstances. But these are, I think some red flag things to be aware of, as well as, how you go about, again, kind of having this flexibility. If you do decide you want to leave, is there a notice component? Is it a reasonable notice component? Does the employer have a notice component? Everything's fine when you're entering into the agreement. It looks good. So many clients say, I didn't even worry about this because I didn't think I had to, which is understandable at the time, but these are the things that you end up fighting about, in the event. And there could be potential liability for in the event, that you don't follow the provisions of the contract if you decide to leave. Buried in there in the termination parts of the contract can be indemnification, which is basically just the legal term for allocation of responsibility, of liability to one party or another. So, some contracts that you see could have an indemnification that says if the employer decides to go to court to enforce this contract, or if you did anything wrong, per the terms of the contract, that you, the employee, will have to pay for those expenses. Being reasonable, that's really, I think, the key for the term and termination. What's going to work, for both parties. And I think you find that, again, not to overemphasize the point, but a legal review, catches these things, or at least a close reading, by the employee, to catch these things and to ask the employer about, or to negotiate further. So independent contractor and employee, that's a major thing to look at. The term and termination clause, that's a major provision to look at in a contract. The notice, what that looks like. If you see indemnification or liquidated damages, which could be a penalty if you leave early. These are kinds of things that you need to look at, more closely. As well as the compensation piece. And again, Dr. Romero, the split, very common, very common, sort of the percentage of collected revenues as a method of payment. You can have a salary as well. You can have a salary plus a bonus. In the private practice model, is going to be a little different than if you're going to be employed by, a larger hospital system or something like that. I think especially the larger, kind of institutional workplaces, you're going to have, in all workplaces, all employers to some degree, but really emphasize in the contract, the compensation model, maybe based on, value and quality metrics. I think that's entering into increasingly, in some of the bigger, the bigger workplaces. I think probably the volume, of patients that you see at this point is more common. But you can do that, not necessarily, just on the percentage of revenues, the split model, but you can also be compensated based on, any number of, RVUs, right, relative value units. And so that can be defined in different ways depending on, your payers, your organization, and things like that. But you can have, a productivity component, right, to your compensation. That can be a bit more complicated than, just revenue collected. And that's going to matter. And that's probably not going to be totally clear, just from looking at the contract, what that means to you, dollars in your pocket. A salary, pretty straightforward. It's a number. You're going to get a bonus if you hit certain, metrics, either quality or, volume based. And then, again, similar to Dr. Romero's, in the first few months or, in the first year or two, a lot of different practices, a lot of different, healthcare employers will have, a transition to a different compensation model, after some period of time. So maybe 2 years at a salary, and then you're solely on, sort of a volume-based compensation. What does that mean? It's going to be different by every contract, but the takeaway is, can the employer tell you what that means? So what's the model, one, and then two, what's the total outlook? And it should be transparent. You should hope that it's transparent. And, what is it going to look like now? And what is it going to look like in the future? And can you understand? Again, I'm sorry, Jordan, I keep coming back to you and using you as an example, but it's so great, the story that you told. It's like, can your employer describe what this means? Can they say, oh, what am I going to be paid? So some transparency and some clarity, is really gonna go a long way for you. The whole idea of restrictive covenants, the non-solicitation and the non-compete, again, that's really something to pay attention to. It can be very nuanced, in the law, how enforceable that is or not. But I think, again, in my opinion, that speaks more to, what is the practice looking to do? Do they have a turnover issue? Are you really emphasizing the restrictive covenant because they're having difficulties keeping folks in positions? And then, part of these things are always going to be determined by the fraud and abuse laws. How physicians are compensated. My takeaway on that, without going further in the time we have, is really, is it too good to be true? Is it too good to be true? And if it is, to do some more digging, to talk to a colleague, to call a lawyer. One of those things, like, there's very few free lunches, and especially when you're being presented with a contract. So these are the things that I think it kind of gets a spidey senses tingling. I'm sure there's probably lots of questions for us, hopefully, have some discussion and dialogue. But I think I'll distill, from what we heard today, just to some things that I think are good takeaways, from a legal perspective here on contracts. So one, legal review, I mentioned it. Due diligence on your employer, talking to pharmaceutical sales reps, talking to other colleagues, talking to whomever you can, what's the word on this employer in the area, with other professional people. So due diligence on the employer, and also some education on the market. So if you get an offer, or you're trying to find where the jobs are, in the marketplace, that's important. Specific to the contract, red flags, so I've gone through a couple of them, the term termination, the restrictive covenants, the clarity and transparency of the compensation model, understanding what the red flags might be, and learning from them, having them, trying not to dismiss them, because where there are red flags in the contract, there may be with the culture and the relationships, and how the practice is being run. And I think that the contract and the contract negotiations set the tone for that. So don't be hesitant to be direct, of course, being professional, and but the business aspect, is real. You've got, the day you start, you're going to have all kinds of clinical challenges, and work that you're doing, and you're going to be immersed in the work. But when you're signing your contract, and when you're onboarding, on that process, that's when it's to think about the business, future earnings, and this is me, and maybe my family, and this is it. So to be professional, but be direct. Don't be hesitant to ask these kinds of questions, and expect honest answers, and transparent answers. Knowing your non-negotiables, I think that's definitely a lesson to be learned. Is a non-compete a non-negotiable for me? And knowing what those are, or what are my negotiables? What do I care about? These are the three things that I want, from my contract. I want a guaranteed salary. I want to not have to work on weekends or on evenings, or, what are your negotiables? What are your non-negotiables? And then does a contract meet those things? And, at the end of the day, I think it's a great story, and great tips that Dr. Romero went through. I think it's just very important to to again, sounds rich coming from a lawyer, but to take this seriously, to take the contract seriously, all these provisions, it can be like, oh my goodness, it's kind of silly. It's not going to matter to me, but take it seriously, have a contract that you're going to be happy, because ultimately, if you're unhappy with your contract and your compensation and the work-life balance that you're getting, you're probably not going to be happy in your life, right? And that's what we're going for. So that's my spiel. So we'll turn it back over to Jasleen.
So I'm going to go on and stop the recording now, and we can open up to Q&A.